and it is about basically 7 p.m. And as a result of an executive order issued by Governor Pritzker suspending in-person attendance requirements for public meetings, Human Service Committee members and city staff will be participating in this meeting remotely. And I need a motion from someone to suspend the rules to allow us to conduct this meeting remotely using Zoom software.
I move that we suspend the rules for this meeting to conduct the meeting via Zoom.
Second.
Okay, all in favor, please say aye. Oops.
Aye.
Aye.
Who's going to be doing our roll calls for us? Kimberly or Ike or?
I can do while we wait for Nicola to get online.
Okay, thank you.
Okay. Alderman Fisk?
Yes.
Alderman Braithwaite? Alderman Braithwaite? Aye. Alderman Simmons?
Aye.
Alderman Revvy?
Aye.
Alderman Fleming?
Aye.
Okay. Our first item of business is approval of the minutes of March 2nd. Have you all had a chance to look at those, and anybody have any comments, questions?
Move approval.
Second.
Okay. Could we have a roll call again?
Alderman Fisk?
Aye.
Alderman Braithwaite?
Aye.
Alderman Simmons?
Aye.
Alderman Revvy?
Aye.
Alderman Fleming?
Aye.
Okay, thank you. So next we're going to move into public comment, and the council rules for public comment in our steering committees provide that each speaker shall have up to 2 minutes for their comments. And in addition, it's frequently the practice in our standing committees that we have the public comment for each agenda item as we get to that item on the agenda. And tonight we have 2 items on our agenda. The first item being the discussion of our responses to the 911 calls for service. So we have 7 people signed up for public comment, and I'm going to just call each person, and if your comments are for an item later on the agenda, we'll skip you and go call on you later then. So our first speaker is Betsy Wilson.
That's a square in my Zoom bingo for the day. Good evening. I appreciate your time and having the opportunity to speak to you all. And I am grateful that you all are looking at 911 calls and police responses to those calls. I think it's clear from the past days that the police force that we have, despite a budget that's far out of proportion with our neighboring communities, isn't stopping crimes. And that's not surprising. We know that police forces are designed to respond to crimes. So I'm glad that you're looking at the 911 calls, but I do want to point out that we as a country have been working on reforming police from within since before Ferguson, but especially since Ferguson occurred. And the evidence shows us that reform doesn't change outcomes. It doesn't reduce the racist effects, nor does it reduce police violence. In order to do that, we need to be moving resources out of the police department and into organizations, departments, and services that address the root causes of crime. So I appreciate that you're thinking creatively about how to respond to calls to the police department, but I do want to emphasize that that's not enough. It's not close to enough. If we're going to be sincere in our commitment to defunding the police, and I'm grateful that we've had such a community such a strong community discussion and that the city council has been listening and responding. But if we're sincere in our commitment to defunding the police, this is only the very tiniest of beginnings. And we need to be looking at how to find solutions to public safety and how to ensure public safety without relying on the police department itself.
Okay,
Thank you.
great, thank you. Next, Mike Vasilko.
Can you hear me? Can you
I
hear
think
me?
so. Go ahead.
Okay, well, hope you can hear me. I was confused about your list. This is not about 911 calls. It's about HSD1 and HSD2. So I heard, and I'd like to hear from Chief Cook. I see he's on the list of people on this call. I heard from some people that Chief Cook is in favor of defunding his own police department. So I'd like to hear that from him if he's on the call, and if he could speak to that sooner than later. Personally, I don't appreciate the term defund when it comes to the police department. I think it's, I hear a lot of people complaining about the Evanston Police Department, and they don't compare to some of the other departments in the nation that have real problems, whereas I don't think we do. And I don't think we should penalize the police department in Evanston. I think if we're looking for cost efficiencies in the police department, as we should be looking at all departments for that same cost efficiencies, since many of the departments we have really, excluding the police department, waste a lot of money and waste a lot of funds that could be going to some of the good causes that people are looking for. I just think they're looking in the wrong place. So I just don't think we should be penalizing. I don't think we should be demonizing the police department in Evanston. I think there's a lot of good people that work there. None of the events that have taken place in other cities across the nations have occurred in Evanston. And I just think it's, we're just not, we're overreacting to something that doesn't exist in Evanston the way it exists in other locations. To the banner issue, or to the hanging items on public property, I did see a banner this last weekend and a banner the weekend before related to this issue, I think. And just FYI, Central Street and Green Bay intersection over the bridge. Thank you very much.
Okay, thank you. Next, we have Daisy Chadwick. Daisy was here earlier. Is she still there?
I don't believe so, Alderman.
Okay. Jennifer Karlovitz. Is she still there? Oh, there we go.
Hi. So I just, I guess I believe we do have the problems. Maybe not to the drastic degree as other places, but I did watch a recent video in which a police officer said twice, or two different police officers wanted to put a young man in a cage. And I don't think, I don't want to live in a place where that's what we do to people for walking down the street and videoing. I want everyone to be safe, and I don't think that people with guns makes anybody safer, whether they're legal or not. Thank you.
Thank you. Next, Priscilla Giles, are you speaking to the police issue?
Alderman, I don't believe Ms. Giles is on the call.
Okay. Then Karen Courtright.
Hi there.
Hi, Karen.
How are you, everybody? Just have a couple of quick comments. And yes, I will allow us to see my video. I have heard some aldermen and others in, city employees be dismissive of the youth who have been speaking to the issue of defunding, and if others would prefer, redirecting budgetary dollars from the police. And I don't think that's right. Year after year, we hear elected officials, city leaders of all kinds say that the youth are our future. And these young people may lack the decades of adult experience that some of us have, but they are the ones who have the vision for how the world will work for them. And we need to be cognizant of that. We need to listen to that and be responsive to what it is that they're saying. I have been mightily impressed by the tenor and the content of their input to city officials. I've witnessed much of it firsthand. I've seen other of it in recordings, and they are able to compose themselves and maintain a calmness that I am often not able to maintain when addressing the same kinds of issues. And I think that speaks volumes to the seriousness and the studiousness of their input. And I'd also like to ask that in these discussions that we try to avoid spinning policies that are currently used by the police, what has or has not happened in Evanston compared to other places, to give the impression that it's not all that important, it's not that big of a deal. Because when the police department tackle Black men and teens unnecessarily, I think of Mr. Crosby. I think of the young man that Jennifer just referred to. That's not okay. And if it is allowed by policy, and I've heard Chief Cook address this, and I give him a lot of credit, then we have to change our policies. And I know some of them already have been. So I could speak at length, as I think you are all aware, but that's all I have tonight. Please listen to the youth.
Thank you. And our last speaker is Doreen Price. Is Doreen still there? Okay. And I think we'll get started with our discussion. So to introduce our item, I do have.
Hi, it's Doreen.
Okay, go ahead.
I had trouble unmuting.
Sure. Okay.
In terms of the speaker previous to me, prior to me, I can't say enough in terms of putting it into the discussions into context of the importance of inspiration and looking at things in a different way. That being young at heart and understanding that wisdom at early ages particularly speaks a lot to the central focus of the issue. It's truly an issue that applies to everybody. Given that the context of housing and having a stable home and listening to some of these young people speak in the context with their parents participating in some of these meetings is truly impressive because it's crossing generations. So given the fact that we can cross generations with that, that's powerful. And especially for Evanston, because we have such a large senior group, of which I'm a member, of course. But I've always kept that aspect of doing something a little differently, because sometimes that's all you need is a change in the way you look at something, and the answers start to come to you. Maybe not all the answers, but at least the path opens up. And so with that, I'd like to encourage further discussion and also include looking at health and human services more than just the police issue right now. Let me read my one sentence statement here. And I summarized it in basis of, we need to fund health and human services to support and sustain well-being, social justice, diversity, and prosperity of Estonians, especially those at risk of losing their homes, and we know about the instabilities with regard to that, of losing their homes with multiple detrimental and destabilizing effects on our entire community. And that includes community engagement and stabilization and all the other issues that come up when people are scared and stressed, and families are being challenged way above any family should be challenged prior to COVID. And our community has endured those things with a lot of really, really great people and effort, even though we've made mistakes as a community, myself included, along the way. We're learning from those, and I think this is the time to really start seriously considering building our health and human services to complement what we want to achieve as a community, and that's to stabilize and to grow and prosper. Thank you.
Thank you. All right, so now let's turn to the first item on the agenda, and I want to begin by. Whoops.
Sorry. Alderman, I have some latecomers to this meeting. Can I let them in? I don't know if they want to make a public comment.
Okay, how many do we have?
Well, it's queued right now. We have a number of people. So do you want me to just bring them all in now?
Oh, so true. I mean, how many do we have here?
9 people are waiting in the queue to come in.
To speak?
Yeah, I don't know. They didn't sign up for public comment, but I just want to be mindful of their presence.
So what does that mean to let
So
them
have them come into the room, and I guess we can ask if they did not sign up, they can make a statement. So we just got to ask if they want to make a public comment, because they did not sign up, but I don't want to not give them the opportunity.
Alderman Revvy,
Yeah.
I've been in touch with a number of the young organizers, some of us on this line, and I shared the link. So I believe a few of them may be part of the Young Black Lives Matters group. I don't have visibility, so I would suggest maybe that we just let them in, and then from there, there's
okay.
contact.
Yeah, I guess I don't understand the difference between letting them in. I mean, so we'll let them in, and then we'll get started on our discussion.
Yes.
Is that right? Okay.
Yes.
So here we go.
Well, I think, but I'm sorry, Eleanor, I think if somebody didn't realize or was late coming in because Rules Committee ran long, I think we should let whoever wants to speak.
Well, I mean, we're talking 90 people. How many?
90?
No, 9, not 90. 9.
Okay, even less. Okay.
No, sorry. I've gum in my mouth.
Okay. All right. Well, can everybody who's going to speak now be super concise? How about that? So we can get to our.
You may want to welcome them to the meeting and then set the stage. So I'm sure for some of them, this is their first time attending a committee, or at least the Human Services Committee, since the last time we met with the City Council, Alderman Revvy.
Right. So I'm not quite sure what you mean by setting the stage.
So we can welcome them to the Human Services. Alderman Eleanor Revvy is our chairperson. Human Services is a subcommittee of our City Council based on the level of awareness, protesting, the letters, the presence, and also the request for the conversation. We started a very detailed report overview of our police budget and operations, and there was a referral made to our committee, Human Services, to continue the discussion. So under Alderman Revvy's chairship, we will now jump back into the agenda. Thank you very much, Alderman Revvy.
Okay, so I'm not sure exactly. So we're starting our discussion at this point then? Or do some of the newcomers have some brief comments they want to share with the committee before we get started? Meg, I see Meg do you want to say something, Meg?
Yeah, so hi everyone. I am a sophomore at ETHS and I'm a writer for the Evanstonian, and the in-depth section and I are writing a piece about the Black Lives Matter movement, and we're just I'm focusing on writing about the government response. So I'm looking forward to hearing kind of what you and other aldermen have to say in terms of like, what are your opinions on the movement? What do you think? How can we deal with Evanston's like racial problems? How can we handle things better, and kind of how can we move forward to make this like a safer space? So.
Great. Okay. Well, welcome, Meg. And tonight, as I think was mentioned earlier, is really just the beginning of what's going to be an ongoing discussion for many weeks, if not longer. So hang in there with us. I want to start out by saying that personally, I truly appreciate our police department and our officers' dedication to keeping our community safe day in and day out. I do hope everyone's been able to watch Mayor Haggerty's weekly Q&As about policing in Evanston. They've been providing, at least I found them, some very helpful in-depth look at our police department policies and practices and operations. And for me, really highlight Chief Cook's commitment to continuous improvement. So I see the conversations that we're going to be having here in Human Services as contributing to that conversation. My interest in looking at the programs and resources that the city is currently using to respond to 911 requests for service was prompted by the many voices in the community that are calling on us to redirect funds from the police budget to human services. And so I was listening to the voices from our community and doing quite a bit of reading about what some other cities around the country have done and increasingly are doing to respond to similar concerns in their communities. And so I learned about the Alternative Emergency Response Service model. And that was pioneered 30 years ago in Eugene, Oregon, and is now being used in a number of other cities around the country. So what these cities have found is, as they examined their 911 calls for service, they found that actually a majority of the calls did not require the response from a sworn officer. Rather, the calls involved non-criminal, non-violent situations, perhaps involving a mental illness issue, homelessness, substance abuse, intoxication. And so what the model calls for then is this alternative response, a two-person team, in many cases with a mental health professional and someone with medical background. And so that team is sent to handle this particular situation. And so it seems to me that this kind of model gets the right people to the scene to provide the kinds of services and support that the particular individual needs in that case. And so I'm really hoping that we can consider whether such a model would be the right model for Evanston. Would it help make us a safer, stronger community? Would it be a way for us to begin to redirect funds from the police budget to human services and other needs in the community? So tonight, what we're going to do is begin to understand better what are the services and programs that are currently available and being used when we have 911 calls for service, and then also take a first look at what some of those 911 calls look like. So I expect we're going to do a lot of listening and learning tonight, and we have people from Chief Cook and others, perhaps from the police department, the Evanston Fire Department, victim advocates, our social worker at the public library. There's a 24-hour crisis hotline at the Amita St. Francis Hospital, ECHO, which is not something I'm even familiar with, a mobile integrated healthcare program, and then our youth and young adults division. So we have a lot of programs that we're using and relying on currently in emergency situations, and we, as sort of beginning for us to move forward with our discussion, we want to hear from, what our resources are currently. So Chief Cook, shall I turn it over to you first for comments from the police department?
Sure. Good afternoon, Alderman Revvy. What we're going to talk about, when you say defunding the police, and what my perspective is on defunding the police, my opinion is, what do the people want? And you all as aldermen, as representatives of the people, I'm working to give the public what you all think is best for the course of the city. My job is to operate the police department in the most effective and efficient manner possible. Public dollars are sacred dollars, and the utilization of public dollars should bring public value. So what we do in the police department should be creating public value for the money that is spent. And if we can do that in a more efficient way with the help of partnerships from other agencies, I like that. And I'm not ashamed to say that. And every leader in public service, whether it's in police or fire or any other part of government, should have the same perspective. Public money needs to be utilized in the most efficient manner as possible. And we strive to do that here in the police department every year. Whatever the budgeting style the city wants, whether it's incremental, zero-based, whatever style of budgeting program, I work to give the public the best value that they can get for their money. Tonight, we're going to look at our 911 calls. And if you haven't looked at the Cahoots program that Alderman Revvy is talking about, I think that is worth looking at. Now, I had discussion with about the Cahoots a couple of years ago because a good friend of mine, Chief Elvia Williams, she's the chief in Richton Park, Illinois. She used to be a deputy chief in Eugene, Oregon. So she is very familiar with the Cahoots program. She came back to Illinois some years ago. She was a chief in Maywood. So we do have a local resource on how we could tap into to get some professional inside advice about that program. But I think when you look at the 911 calls, and we have them, you have them in your packet, and we have them in an order where you can decipher them. You can see what needs to be done in terms of dispersion of activity from the police department so that we can look at being more efficient with community relations building, getting into foot patrol. I want to see us have a larger foot patrol unit here at the police department, looking at connection with our youth, as someone just spoke about. We have 6 youths from the Hickey Powell Foundation here working in our police station. And it's amazing the value that you can get from the conversation with these students. We are also here in the police department working to develop our youth advisory committee. They'll have the same input and spunk, hopefully, as some of the adult outreach programs. So I'm really happy with where we are in terms of being able to look at things that have been a problem in law enforcement many years before I became a law enforcement officer. I think it's time. I think Evanston is being proactive even though we're not necessarily having a lot of the issues that they have in other departments, it's still time for us to look at law enforcement in general and say, what can we do better as a law enforcement agency to stay ahead of the curve with this deal? So I have with me tonight Mr. Chris Voss. He is our Deputy Communications Director. He is astute in our CAD system. And when you all ask for information and statistical data, a lot of times I turn to two people in the police department, Sarah Jones and also Mr. Voss. They're good at looking at these modules that we have in our CAD system and gleaming out the information that can point us as a group. And I look at government, meaning you all as aldermen, and the police department as partners here to achieve one goal. So I'm gonna let Mr. Voss give you his synopsis of what he thinks the information we can learn from with the 911 call.
Okay, thank you.
I was given the agenda outline and kind of put a couple points together in reference to some of the questions in review of current responses and resources for 911 calls, and whether which divisions we utilize on a regular basis, and how 911 calls are parsed out and to surrounding or to our agencies. So generally, 911 phone calls, when they're taken, they generally fall into two categories. They're either going to be a fire-related, medical fire calls, or they're going to be a police-related or potentially police-related situation. In the event that they are not in either of those categories, then a 911 operator will transfer that call to the proper authority, generally 311. Sometimes the police desk if the call is not an emergency call. In reference to whether or not we dispatch directly to victim advocates or social workers or youth organization, we do not currently do that. But we use our resources through the Evanston Police Department to determine whether or not victim advocates are going to be necessary for the type of call. We'll dispatch a call to a crisis intervention trained officer. And our 911 operators are also crisis intervention trained for call taking, and they stay up to date on those trainings. Is there any question in relation to that part of the outline?
Committee members?
Okay.
Why don't you go ahead and...
I'll continue along. In section 2, 911 calls for service, and so what do calls reveal about the kinds of emergency services our residents need. As you can see in the agenda, that's parsed out. That information is broken down into ward. That is a general outline of what type of calls that we receive. Now, that particular outline includes all calls dispatched, whether they or some of which come through 911 and some of which come through the desk. You'll see parking complaints and the like included in that list. Parsing them out into 911 only calls is a little harder to do through the CAD system, but I was able to determine that of those numbers that you see in that report, 14,961 of them were dispatched calls that came to communications through the 911 center through our phone lines and were dispatched to the police department, and another 10,306 dispatched to the fire department. And that's from a grand total of nearly 40,000 911 phone calls received in 2019. Whether additional analysis is needed or can be available, we can probably break down a little further the data there, but we would need a little more time to do something along those lines. And then potential community partners for alternative emergency responses. My notes on that basically are that emergent situations need quick responses with personnel trained to handle the situation if it turns bad. That's why we have CIT trained officers as well as CIT trained dispatchers, and all of which also include regular training in mental health call taking. And the entities listed here are not ones that we generally work with in direct dispatching to. However, that's something that would rest upon the decision of the chief, and I'm sure that some way we can look into those partners should the situation warrant it.
There's a question from Alderman Rainey. Alderman Rainey, do you want to go ahead?
Chris, in the first section where you have, calls by ward, let's see, what is it? Type service or type percentage. I don't see the 8th ward listed. The last ward is 7 and then it goes to 1.
Yeah, hold on, because I believe some of the data is not in direct sequential order, but let me look and see.
That looks like a typo, and I think if you scroll down, it goes back down to you see all the other words.
Yeah, but it's when the wards are the first section, I really want to see that, but you don't have to look for it now, but if I could get it later, that would be good.
Sure. Right.
Alderman Rainey, in the packet, I think we were added to the second.
No, we're in the second, but I don't think the first numbers are there.
Yeah, I got it. We'll get it to you, Alderman. This is your ward is in my packet here.
Don't worry about it. Don't worry about it now. We'll get it later. Thank you.
All right, so let me reiterate some things that Chris just spoke about. Somebody asked about the services, the services outside of what we would normally utilize in the city. And for those who don't know, we do utilize the youth and young adult services. They are someone that I rely on. I believe in those guys. I believe in that type of intervention in communities. It's a great thing. I was just talking with Commander Spencer of Chicago Police a couple of days ago in the uniform store. He's the commander in the 11th district, and they had a violence interrupters in their neighborhood. The 11th district is about the size of Evanston. They got about 75,000 residents in the 11th district. But last year they had, I think it was like around 70 murders. What they did was they have their outreach workers there at these homicide scenes. And not only are they looking to provide counseling services to deal with trauma that youth may have experienced from being involved or in that proximity, they also there looking for people who they could give jobs to. That is one of the things that I really like about those interrupters over in the 11th district. But when you look at the services that how they do the Cahoots program in Eugene, Oregon, they sent out 2 people. They sent out a paramedic and a counselor or a social worker, you may call it, but they versed in a lot of things. They know how to deal with mental illness. They know how to deal with domestic violence. They know how to deal with homelessness. And we try to emulate that type of training here with our critical incident training. Just so people know, we got 148 police officers here now. And I think it was like 89 out of those 140 some cops, they're all CIT trained. And I'd like to thank Cook County and Deputy Chief Wright for helping facilitate that here. These officers are trained to deal with a number of incidents that take special training. We've had police officers talk people out of suicide because of their training. We've had them in the neighborhood, calming the neighborhood after violence, and they're all familiar with this. And we continue to train people in that area. That's why, when you look at the diversion of resources, if resources can be utilized somewhere else to the same result, I think that's the thing. But we do need our here training and to maintain a staffing level that's commensurate with a town of this size. This is a big city, and we have big city issues, and we need to be as versed as possible in providing good, clean police service in this town.
Okay. Any questions from the committee at this point? Alderman Rainey, are you?
I'm fine.
You're fine, okay. Could you just tell us a little bit more about the CIT training? So is that how extensive is that? And is that something that the officers get refresher courses in, or is the goal to basically get more and more officers trained?
Yes, ma'am. And I'd like for Deputy Chief Wright to come on board and talk about that.
Good evening, Alderman Revvy, members of the committee. So our CIT training, like Chief Cook said, this was something that was in partnership with Cook County Sheriff's Police. We started CIT training, I believe it was 2016 or 2017. I'm sure most of you remember it was part of that 27-point working plan back in 2017. And if you go back and look at that historical reference, we started off at one point with just like 12 officers, and from month to month it built over time where we were able to, in conjunction with Cook County, use a local training partner through the Illinois State Training Board to pretty much train about 65% of our department. If you look at our department compared to other suburban departments, statistically, we probably have the most trained. We do have the most trained officers when it comes to percentages. Our goal was to first roll that training out to our patrolmen, because they were the first people who were responding to the scene. And then after that, we started to train our specialty units to supplement, patrol at various levels when staffing was short, and our juvenile officers might be the first to respond to an incident when it's juvenile related as opposed to patrol. So we tried to work to make sure that this training was disseminated throughout the department, where it would benefit the community depending on what unit was responding. That training is intense, and when I say intense, it's compared to what other departments or what other members from another agency may receive. This was a 40-hour training, and the feedback that we got from the training, which made us send more and more people, was that it was intense to the point where officers felt comfortable coming back to the police department and actually utilizing those skills in the community. Meaning this wasn't a 40-hour training where they felt like they were, in class and away from the department for a week and came back, and based on that 40 hours of contact, some classes you'll come back and you may feel like you only got 8 hours worth of content, but this was a full 40 hour of content that they thought was relevant in dealing with various members of the community when it comes to, and I shouldn't say this the training is designed to deal with people who are in crisis, but the training that you receive, you can use at just your regular everyday interactions with the public. It teaches you how to step back, use empathy, assess a situation, and then deal with that situation based on the training that you receive. So although it's meant for dealing with people in crisis, our officers apply it in their everyday dealings with the public.
Thank you, Deputy Chief Wright. Does any of the aldermen have any questions about that?
Alderman Fleming?
Yeah, I do. So if I look at the cost for service and a lot of well-being checks, and it doesn't go into exactly what that is, but even with your CIT training, would you say that while the officers feel comfortable doing that, that is not their profession, right? That is, you're trained to do a lot of different things, and you do them based on the call you're going to. But even if you get to a place and you're dealing with someone in crisis, do you feel like the officers have the tools to then get that person to the next place? So if you're able to calm the situation down right there, people probably need long-term support or other referrals. So how do you go about doing that?
How do we go about referring?
Well, I mean, there's a referral piece, but there's also you all are responding to something that's maybe a heightened crisis, and you're able to do, I'll say, triage. You know, if we're lucky, imagine you're not able to calm everyone despite the CIT training. So then what is that other step that our officers take if they're able to just do kind of a temporary triage and the person needs more services, or you're not able to, I'll just say, calm a person because I don't know what the situation might be.
Yeah, and so let me backtrack. So I don't want to come off like, the 40 hours of CIT training replaces a mental health expert or a mental health social worker or a clinical psychologist or social worker who's been, 4, plus 8 years of schooling and has an extensive background in that subject. It's a tool that our officers, use, and a training that has helped us, like you say, meet someone on the scene, be able to de-escalate, be able to show some empathy, kind of like meet them where they're at, and then get them all for the clinical treatment that they need. So what that will look like is an officer responding to the scene, being aware of the situation that someone may be in, and being able to get them to a point where we can, safely, hand them off to a paramedic or safely transport them to our emergency rooms for services there. Both St. Francis and Evanston Hospital have emergency personnel on scene to deal with people in those crisis situations. So our job and that training is basically just to bring them from a heightened level down to a level where we can deal with them and where our EMS personnel can deal with them to get them transported to an hospital. And no, in not every situation will these tools and techniques work. And that's where we sometimes have to resort to, like physically taking someone in custody and transporting them to a hospital.
So my next question then is regarding that. So everyone, I think you said everyone or close to everyone, the majority of officers have this training. Probably just like any job, some people are better at some things than others. So when you have this call, do we have any ability to send out certain officers who might be better skilled in dealing with someone, say, with mental health crisis? Or is it simply the matter of how the CAD system works and the officer who's closest, or however you all filter out officers, goes to the scene?
Well, that's one reason why, Alderman, that we trying to get our whole department certified in CIT. And then we have our state mandated mental health training. And then, I'm part of the mental health board that the mayor has. These are some of the situations that we discuss is how do we get away from the revolving door of dealing with these crisis issues, for instance, with mental health, domestic violence. We get the patient to the hospital, and then a day or two later, they back out on the street. and we're responding again. So it's a repetitive cycle that really doesn't address the core issue. But part of our training is to be efficient in that and to be as professional as we can with the education level that we receive from this 40-hour training. It's a week-long training, so it costs money just to send a police officer to the training, because I send them there, if it creates an issue of hire back or fill in for that officer being gone. So you get that cost, then you get the travel and lunch money associated with training those officers. That's why it takes as long as it do. But I was really shocked when I came here to see that Evanston had, at that time, they had probably about 65 officers that had went through this training. And being able to have the funding to do that is really a great thing here.
Right, but in terms of the response, if we're looking at the 911 call response, you all send, if it's a mental health crisis call, say you have that much information. The way that we disperse officers isn't based on necessarily, let's send Officer Wright because he has CIT training and he's really good at it. We send officers based on some other process, correct?
Well, we take a combination of both. So our dispatchers are, like Vol said, are trained to recognize those situations and those types of calls when they come in. So they're recognized to train people in crisis situations. Also, in our daily, let's say our attendance log, every officer who is CIT trained is listed on that log. So when a calls for service comes in and it's recognized by the dispatchers that a CIT officer is trained, they won't necessarily send just the beat officer who may not be trained. They're trained to recognize that crisis and send a CIT trained officer to that scene. So in a lot of cases, you may have more than one CIT trained officer on the scene that requires them to be there. And in those situations, whoever, has or feel like they will have the best control of that situation will take the lead. So in these cases, it's not dependent on whose beat it is or whose call it should be. It's, who's best to handle the situation.
Thank you.
And as well, to address that, when the call is completed, there is a different type of disposition that is in the CAD and RMS system specific to mental health issue calls so that they can be tracked accurately after the fact to make sure that all protocols are followed along those lines. An officer will close out the call with a specific code tied to saying that the call was mental health related.
Alderman Fisk, you had a question.
Jody, are you still with us?
Yes, ma'am, I am.
Thank you. So I'm curious as to and first let me say that I really appreciate the fact that you are trained and for the folks that are and in order to respond. But I'm looking at trying to figure out how we can make this work better and how we can address maybe some of the problems that the police department may have with folks appearing back on the street next day and follow up with people who might have serious mental health issues that we need to better evaluate and treat. So I'd like to know how you feel this would work if we had an outside team of mental health providers, for example, who would either respond with the police or respond instead of the police, or how you see that working. Would that be something that you think is workable, that the police department would, or the members of the department that you're aware of would welcome? How do you see this How do you see this working?
Well, that's a lot to intake, all at once. But I will say that, so when we say how do I see it working, it's one, having these social workers at the table to have this conversation. Most social workers, and I'm not even talking about the ones that we deal with that are part of city staff. These could be, child welfare social workers or just, mental health social workers who want to go and visit a client. Most of those social workers aren't comfortable going to that house knowing the state that their client is in. The first thing they do when they arrive in town is call the police and, have the police meet them at the scene. So one, I think, having the social workers at the table to have this conversation and seeing their comfort level. I think when we talk about crisis workers responding to a scene, especially as it may relate to someone in a manic state or someone, for instance, I've been hearing domestic situations a lot. Those situations can turn volatile in a snap of a finger. So most social workers know that, and when they're going to deal with these type of patients and clients, they want the police on scene with them. So not having that, and I'm not saying this is every case, and I'm not saying that this model that we're looking at wouldn't work. I think, it's hit or miss. You don't know when you send a social worker to a scene without a police escort if it's going to turn violent within the snap of a finger. And if you don't have that police worker that's there or staged somewhere nearby, then the response could be that much delayed, and then the problem has gone on, for an extended amount of time while the social worker is trying to deal with it. If you ask police officers, not just in Evanston or just across the U.S., when it comes to dealing with people with that are in that crisis state, it's not fun, but we get the training and we do it because that's what's expected of us. So I know there was a lot of questions that you had in there, and I don't know if I actually covered them all. Like I said, it was a lot to intake, but if you ask our police officers, I mean, we want to get to a peaceful resolution. So if that means having a social worker who's better trained on the scene with us, I think most of us would welcome that. And I feel comfortable speaking for the members of our department when I say that. People, the last thing that you want to do as a police officer is be involved in a use of force situation, and then be involved in a use of force situation when you know that you could have had the tools or other personnel there to help you, assist you in that situation.
Thank you. Other questions from the committee? Chief Cook, do you have more from your?
No, we're more than open-minded about where we are in law enforcement. We ponder these. I sent out a lot of information about where we are in the state of law enforcement, through the International Association of Chiefs of Police, the Police Executive Research Forum, which is PERF, and also NOBLE, the National Organization of Black Law Enforcement Executives. And these are the organizations that are redefining where we are in law enforcement today. And we stay up on this literature and look at our organization as a template on how we can be a model for the rest of the world. And it's an open door here in terms of information. I want to thank Mr. Voss. In our CAD system, we have a robust CAD system with a lot of information stored in it, and we can break down beat information, time, and things of that nature without a problem.
Alderman Simmons, yeah. Go ahead.
Thank you. So I really appreciate this discussion. I want to get more educated on best practices, other models. I have some more questions. I want to do some research first, so I'm glad that this is for discussion. I'm also glad to hear that the chief is in support of the will of the majority of the community in moving forward with defunding. And I would like to recommend that we prepare at least a statement. It could be proclamation or resolution, just the intention, the commitment on behalf of the city council. It seems that we have majority support, and we could at least move forward so that the residents, especially the young activists that have worked so hard over this summer to educate the community and push us towards, serving the community better, if we could move forward with some type of a resolution of commitment to move forward in this direction. And of course, we would have to continue on with the action, but that would, I think, be an appropriate response to the amount of effort and the concerns, the valid concerns. And although we are fortunate that we have a strong community policing model, we have a chief that supports that. We don't have police terror, but we do have some evidence of over-policing in certain areas. So I would like to make that referral or recommendation that we move forward in some sort of formal commitment that we are working towards defunding.
Alderman Fisk? And Alderman Blakely. Oops.
Sorry. Sorry. One of the things that I'm okay. We just have a little dog issue here. So in all of the emails that we got from the various different groups of people who expressed their ideas about defunding, I really think we, as part of that statement, I'm not against the statement, but I think we really need to be clear, and this is what I was hoping that we would do, not only through our discussion at Human Services, but listening to the experts in the field. I guess I really want to give an idea to certainly the people in my ward about what defunding actually means. And my own feeling is that I would love to hear more about the program in Eugene, Oregon, how that might apply to us here. I would almost like to think of the police department as a community center. I know that sounds silly, but the use of social workers and outside workers in my ward dealing with panhandling and homelessness and other, especially the suicides that we've had in my ward. I've been just extremely impressed by the communities of knowledge coming together to de-escalate these situations. They've been incredible to watch. And so I guess from an idealistic point of view, I would love to see a police department that has a social network and a open policy, so that we're not just a intake desk and some cells, that we're more than that. Because I think as we discuss these issues, they're so complicated and so deep-rooted and start at such a early age for a lot of people that it's going to take more than our police department. I mean, it's going to take our schools, our police department, all the community organizations that we have, and bringing in everyone in the community to be part of the discussion. So if we have an idea of what we mean by defunding, I'd say, fine, let's go do it. But I think there is some confusion out there what it means. And I want to make sure that that conversation that we have is as broad-based as possible, because we can talk as a council and as a committee, but getting out there in the community and saying, here are the people that we've talked to. Here are some models that we think might work. Here's our goal, and working with the community's vision. Here's how we're going to get there. I think is a very worthy effort, and one that's long overdue. So I'm a little bit confused about a statement right now. I will, certainly work as hard as I can to make sure that our conversation here and certainly in my ward is complete. But I think we have some homework to do first. That's my own feeling.
Alderman Braithwaite, you had your hand up.
Thank you, Alderman Revvy. There are a couple of comments I want to make, and I think I'll make this statement first. First, I want to thank Chief Cook for being the tremendous leader that you are for the Evanston Police Department. Thank you for the officers that have joined to help us as we explore this whole defunding. And Alderman Fisk, I want to share with you just a private conversation that I had with some of the organizers with who one is on the call. And so I think where I was able to have movement is we move beyond the word without losing the meaning. So we got to a place where, and I pulled this up because, depending on who you read, whose philosophy, it could mean something different. And at the end of the statement, I'll tell you what I plan to do. So defund the police means reallocating, redirecting funding away from the police department to other government agencies funded by local municipality. That's it. It's that simple. Defund does not mean abolish policing. And in some who say abolish do not necessarily mean to do away with law altogether. Now, I took that quote. His name is Rashawn Ray. I don't take credit for it. He's a David Rubenstein Fellow, Governmental Studies. You can Google that later. But the point is that they invited me into a conversation to explore it, right? And I personally had to get over that word. And when I stopped arguing and we got to a place to where we're talking about it, I think that's where we are now as a community. So my promise to them is, after doing a lot of listening, I really want to stress that I really have to listen, is twofold. I think it's important that we create a landing pad for our youth and our leaders in this town. I think that's very important. And then the second thing that I'm committed to doing is having a broader conversation, because I think that this is not necessarily limited to race. Maybe some will disagree, but it's more like intergenerational. And I am committed to having this meeting with my second ward residents and listening to my residents as we define it. And then more importantly, listen to my residents as it relates to the budget. I want to quickly move past this because we're going to talk for the young leaders that are on the call, just a point of information where we are. At the beginning, and I know some of you joined late, is typically when we take public comments. And so that would have been your opportunity to speak. I assume that this conversation will carry over to the next meeting, and we'll make sure that you are aware where you're able to make your comments and we can listen as a committee before we finish up our agenda. And I think those are my points. Yes. Luke, Kimberly, if you can open up the chat feature, that as we are having this conversation, if we can record their comments, that would be very helpful. And if you can please add to the chat feature the link that has the agenda as well as the presentation, that would be great. Thank you, Alderman Revvy.
Alderman Braithwaite, I would ask if they have comment that they send it to staff, because at this time, because the meeting is in duration, the chat functionality is not available.
Okay.
So they can direct it to staff and we'll make sure it's included in the public.
When you say direct it to staff, I think you're going to have to provide an email, or for those that are in the know, they can send their comments to either myself, Alderman Revvy, Alderman Simmons, or Alderman Fleming. I know that Rainey's on the line and we'll make sure to get them to you. Thank you.
Yeah, no, if they could send it to any one of us, and then we could make sure the whole committee gets any of those comments.
Yes, thank you very much.
Can we actually give them one email address and then that gets sent to the entire committee just for ease and efficiency to make sure we get them all?
Okay.
Great idea.
Because I know some may have rapport with one alderman and not another. So if we could have Kimberly, if you don't mind giving an email, the right staff email address.
Sure. Since my name is on the, you can just put K Richardson at cityofevanston.org. And it's Richardson, RICHARDSON.
Well, Alderman Bruce Simmons, I think, I guess I'm going to agree with Alderman Fisk that I think it's, I'd like us to have some more conversation so we have a clearer, when we talk about what our vision is, that we have a clearer idea. Just because I think there is such confusion in the community about what we would mean by defund. So I'd like us to continue our conversation a bit longer before we actually get to articulating a resolution.
And so I appreciate that, but based on, Alderman Braithwaite just gave a really coherent, easily understood explanation as to what defunding is. And we've been having this conversation for some time. It seems that everyone on council is supportive of the goals of defunding. It's the word that we're stuck on. And we even have support from the chief himself. So I think a statement of, support is appropriate, understanding that we're working towards the application of it and how does that work. And I understand that we have to go into a budget season and I imagine it'll all be wrapped up in a budget conversation. But I don't know just think it's the word that everyone is stuck on, but the commitment is there on behalf of everyone.
Alderman Fleming.
Yeah, so I will just say I'm struggling a little bit. We've been on this call maybe an hour. According to the notes, we have several agencies we're trying to hear about to understand our current response to 911 calls, which is important as we try to figure out where we, need to reallocate funds to. So it's, moving a little bit slow. And regarding the resolution, I guess my feeling is because we are trying to get this done probably in the next month and a half before we hopefully have something to present at budget time that's going to lay out whatever new program or services or whatever we're doing with this reallocated police funding. I'd much rather get through this and make some actual policy changes and budget allocations versus having staff spend time on a resolution. I mean, if some are learning, some are in different places in terms of wording and speaking to their constituents, that maybe, I've been speaking to my constituents for a month now, so maybe I am a little further ahead. But what I thought the goal of this meeting and subsequent Human Services meeting was to go ahead and start making this plan. So part of that is tonight, getting information, learning what we do have, looking at other programs. I think we're going to try to meet several times in August and then again, sometime in September. So I would love for us to kind of get the ball rolling and actually just go ahead and defund, reallocate whatever people are comfortable with in terms of a word. I don't really care. My concern is getting the right services, getting the right response to people in need in our community. And I think we all agree that that's not necessarily an armed police officer with, all the stuff that they wear when they go right. That is not the response that everyone needs. I think also Alderman Sufton and I had a meeting where we had a very long conversation with legal counsel who talked about, right, there are some legal obligations we have with the police union contract. So I want to make sure as we look at defunding that there is time for our city staff to make sure that we can get that done in this budget year and we can get that done without violating a union contract that potentially would end us in court. So I want to make sure we have time for all that to transpire. So by the time we approve a new budget in November, this is all kind of said and done, and we can make that practical commitment to our community. So, I'd rather not have, my personal opinion, staff working on the resolution. I'd rather us just, keep moving in this direction of tonight's meeting and subsequent meetings to actually just make some inroads on making these reallocation decisions and policy changes so that our citizen base can see us, doing the things they've asked us to do, and we have a very short window of time to get them done. So Alderman Revelle, if we plan to get,
I appreciate your comment, Alderman
if we
Fleming.
plan to get to these things tonight, I'd love us to keep going here.
Right, yeah. So we could talk all night with Chief Cook and his officers, but I think maybe we'll move on to hearing from Chief Scott about what role the fire department plays in.
So I'm going to continue with my comment. So, and I appreciate the pushback, and I get it. And I'm usually the last one that is for ceremony, but we do it so often. We have resolutions that are a goal towards a thing, and then we work on the thing and we implement it sometime later. Why is there pushback on this? That's really my only point. So I agree. I mean, we have hundreds of resolutions that don't necessarily have an action plan. That's what that tool is there for, to make a statement and a commitment. So I would still be in support of moving forward with a statement. And if it's not policy, if it's not a resolution or ordinance with a number and it doesn't work through that process, that's fine. But I think that a statement is worthy on behalf of the city council that we are moving forward with defunding, just in response to the extreme advocacy, education that's been happening in the community meetings, and even now, response from our chief of police. So I understand that there's not support for that, but I needed to say that we do it often, and it at least holds us accountable. We can then refer to our own statement and commitment in resolution as we work towards the goal. I get, time is of the essence and staff has already worked really hard and so are we. But we've done it before and I don't see why we wouldn't make the same consideration at this point for this very, very important policy that the community has rallied behind.
I get it. Alderman Fisk?
Well, I'm not sure we've ever done that for a discussion item that's at committee and where we've set out a fairly aggressive schedule for discussion, and especially this early in the discussion. I think it's enough right now to let the community know that we're moving ahead and welcome to join in the discussion about it, and that is our intention. I think Alderman Simmons, you're correct that that the council has basically agreed that this is the direction we want to follow. It's just I think just a little bit premature and it takes away from that we're going to need an incredible amount of staff time to help us with this stuff. I mean, it's just to be on the kind of schedule that we're on. I'm just not sure that it's fair to anyone to add this to their burden. I wouldn't want to ask them to do this at the expense of not getting some more information. If you think it's important, then I would say, and we're going to go ahead with it, I would say that definitely we need to make a decision tonight to agree on a definition of defunding, and whether it's what Alderman Braithwaite read or whatever, that we need that definition to be out there. I know you've done an incredible amount of work in your community, but I know from all of the feedback I've gotten, and I've talked to a lot of people in my ward who are just very confused about this and are looking for some direction. And I've promised them that there's going to be a serious in-depth community discussion about how we can provide what Alderman Fleming said, the best possible service to our residents and people who need help, and deorient this from the police department and into the hands of professionals who can maybe provide better service. I don't know what that's going to look like now, and I don't want to be in front of a group of people saying, yes, we're defunding, but I don't have anything else to say. I have a ward meeting coming up on September 1st. I'm hoping that we will be meeting every Monday until then, so that we've got a better idea than going into budget season exactly what we're going to do. But I just don't want to go out from our first meeting as a committee where we're discussing this and say we have a resolution, unless we want to spend the rest of the evening tonight talking about that resolution. And I don't object to doing a resolution when we have a little bit more information, but I just think it's premature.
So I am going to move us along, and Alderman Simmons, I guess I would say to the community, judge us by our actions. We're going to move as definitively and expeditiously as we can to come up with a program that will be, part of the 2021 budget, and that they will see that we're taking the actions that they really are counting on us to take. We've got a whole bunch of people, I think, who are lined up to talk to us this evening about the kinds of programs and services that they are already offering to the community, and we really need to hear from them, I think, this evening. So I'm gonna move us forward and ask, and thank again Chief Cook and your officers that were here with us, and turn it over to Chief Scott to see what you want to say to us about the role of the fire department in terms of responding to emergency services, and it's particularly cases of mental illness crisis or homelessness, or one of those kinds of situations that really needs a social worker or a mental health professional. What is the experience of the fire department?
Madam Chair, members of the good evening, Fire Chief Doreen Scott, and let me start by saying thank you, Alderman Revvy, for inviting us to this discussion. I think the fire department's always looking for better ways to serve the community. And when I read your invitation and looked at the Eugene, Oregon CAHOOTS model, it really kind of reminded me a lot of what we're already doing in a limited way with our ECHO program. And for those that might recall, the Evanston Fire Department, in partnership with Amita St. Francis back in 2019, put in place a mobile integrated healthcare program or community paramedicine program, which focused on some of these issues. So that program really tried to focus on preventing emergency department readmissions. And while doing that, it tried to focus on providing healthcare system education, home safety inspections, as well as looking at social service referrals. And some of those things did relate to substance abuse and mental health. In fact, even before we looked at this alternative emergency response model that you brought forward, Alderman Revvy, in the committee, we've already had some preliminary discussions with Amita St. Francis of expanding that ECHO program and looking at something that the city of Los Angeles is working quite successfully with. It's more of a direct services approach, where they're actually taking fire department ambulances and looking at something called an advanced provider response unit. And what they're doing is very similar to CAHOOTS, a program that originally started out of Mesa in 2007. Los Angeles has adopted it since then, where they will pair up a fire department paramedic along with a nurse practitioner or physician's assistant, and also at times even a mental health professional, where they can triage at the 911 center particular calls that may be a low acuity and may not necessarily need the response of an advanced life support unit. But we can send out these type of resources in an integrated way, in a more efficient way, to get the people the type of services they really need, the type of experts they really need, in a very proactive, personal way. So this discussion really comes at a very opportune time for us, because I think Amita St. Francis has been an excellent community partner in this dialogue. They have always been, ever since we originated with ECHO. And I think they're very interested in looking at expanding that program into more of a direct services model. And I think that maybe we can help in terms of that integration, support the Evanston Police Department, support our Health and Human Services Department, and other external stakeholders that may perhaps better serve the disadvantaged in the city, especially when it comes to issues of mental health and substance abuse.
So Does ECHO stand for something?
It does. It stands for Evanston Community Health Outreach.
Alderman Fleming?
So Chief, right now the ECHO, I thought it kind of serves people who are identified by St. Francis. Is that correct?
That's correct, Alderman. And so we're not seeing the amount of people in that program that we'd like to see. So I'm kind of pushing a new vision for ECHO where we have more of a direct services approach. So I've really kind of latched on to this Los Angeles model, but I certainly see where we can blend this between the LA model and the Eugene, Oregon model, perhaps, where we, again, I think the most important thing for me is that these services be integrated across all stakeholders so we have the most efficient use of these services and the people in the community get exactly what they need at the right time.
So in this new kind of blended model vision, there would be a call that came to 911 or some such, and the operator would have the opportunity to send out the ECHO team.
That's correct.
And right now, the ECHO team is a firefighter and a nurse, is that correct?
That's correct. The current iteration of the program is where we get them once they're at the ER and they're ready to be discharged, and we enroll them in the program at that point. I'd like to see if we can shift this to where we have them at the point of 911, we can be directed to people at that point.
Okay, and do you see this program adding on that mental health or crisis intervention staff?
I think it's always been a part of the program in a limited sense, and I think we need to maybe expand that. And so I think, yes, that's something that I think both on the fire and police side, we see a high number of calls that deal with mental health. And I think we, on both agencies, would like to deal with them in a more efficient way.
And so if you expanded this program, I'm assuming we would not expand our fire, or our firemen. And so this would be an expansion, just adding on potentially more staff, either with a partnership with AMITA or whoever else, versus bringing on more firemen to man ECHO so we can expand it.
If we were to expand the program and go to a 24-hour model, it would most likely necessitate additional staffing. At this point, my discussions with AMITA St. Francis are, to what degree are they willing to fund the program? Will it be, providing some of the nurse practitioners, providing the physician assistants and so forth? Will they be willing through their foundation, maybe even to provide more funding? At this point, I'm not sure, but there certainly could be a certain degree of financial incentive for the hospitals because they'll have less people coming into their ERs unnecessarily.
And right now, how many firefighters do you use for this?
For the current ECHO program?
Yes.
We just have, we've trained a number of them, but right now we're primarily using just one firefighter and one practitioners at AMITA St. Francis.
And so right now it's working at like a 9 to 5 kind of a schedule.
Right. As people are enrolled, we send out the team to do their work.
Okay, thank you.
Alderman Fisk.
Hi, Chief. So what would it take to, in terms of staffing, to bring this to a 24/7 operation?
Very early at this point, very preliminary with the discussions with AMITA St. Francis. But if you were looking to expand just a ambulance service overall and make this a part of that program, we'd be looking at least 9 additional firefighter paramedics.
So on my list here, I have this 24-hour crisis line at AMITA. So is that related to this ECHO program, or is that something separate?
It is something separate, Alderman.
Okay.
When you see on your item list, ECHO is that partnership between the Evanston Fire Department and AMITA. It is our mobile integrated healthcare program.
Right. Okay. Yes, Ms. Castro?
Hello, so I am Amita. So I am the manager for the outpatient behavioral health clinic. So I don't want to segue into it and just kind of go with the flow. If you guys want, and we can talk about the 24-hour crisis line and the library and all the already partnership we have with the city of Evanston.
Sure, yeah, go ahead.
Okay. Well, thank you, everybody. Good evening. So as I mentioned, I'm the manager for the Outpatient Behavioral Health Clinic. So going back, we've actually had a contract with the City of Evanston, or just what we would call the Community Support Program. So this would be where ideally it was working with the victims advocate workers at the police department to get those direct referrals on what we call the frequent flyers. So what Chief Cook mentioned earlier, people in and out of the hospital, come in for a couple of hours, don't meet criteria, and then get discharged. So we would be kind of that follow-up or that triage where we would get the police reports, follow up, be it a phone call or a home visit, and then try to assess a little bit more and see what the appropriate services are for that resident. A lot came out of that. I think we learned so much with that aspect of it, just in terms of HIPAA and having consent and having the victims advocate do a little bit more instead of us doing cold calls or cold visits. We were at a point where we were making those calls and going to the home visits, and the residents knew nothing of who we were and why we were there. So that ended up being like more of a conversation. And even pre-COVID, when I was meeting with ICON, how can we clean this up a little bit better and make that warm handoff with respecting HIPAA and making sure that people were agreeing to this follow-up in a way. So I think that's still in the works. Right now, we're getting referrals from the General Assistance Office, mostly from their workers. If they have somebody that they identify as just needing mental health services and are not set up with anybody's, then usually they'll call me and I'll try to meet them. Right, pre-COVID, we'll meet them at their, Levy Center or even at the General Assistance Office. But now it's been just a lot of remote stuff that we're doing. So I think that's something that we could clean up, like as I mentioned before, and be that follow-up. We have been in conversation with Chief Scott in terms of the ECHO program and how we can better support that aspect of it. That is through the St. Francis ER. We do have crisis workers there. So we are looking to see how we can do that. We currently do have police social workers in Melrose Park. So I actually have the manager of the crisis line on this video meeting as well. But we already have something similar that we can probably integrate into what we're already doing. So I think it's just really laying it out and seeing how we can better serve the community with the resources that are already here. We just have to expand on them and make it a little bit more clear. So then we offer that. So part of it, right, is our community support program where we're doing the follow-up. Then we have our library social worker. We have a full-time social worker at the Evanston Library. So we provide services there. All these services are free, even our community support program. They are definitely, Christina just jumped on. She's our library social worker. These are, we don't ask for, we're eliminating the barrier of meeting the residents where they're at. If they're at the library, then Chris isn't available. She's pretty much on call when she's there because he might be on a different floor, pre-COVID, of course, right? And then they would just call her cell phone and then she'll meet the patron on the second floor, the third floor. We do a lot of case management. She supports not only the patrons, but also the staff, and we do trainings at the library. And then right now, even with COVID, we opened her up to be available to the city of Evanston for the residents. So she was getting a lot of calls on people trying to link to services, helping them with their stimulus checks, with unemployment, and stuff like that. So that's, and then we have our 24-hour crisis line that's available it's open for any residents of Evanston to call. And that's a crisis line where it's a person answering the call, and they can definitely assist in any way that they can. And now we're part of the Evanston Care Network. So, and then also as a 311 prompt, they can get to our crisis line in that way as well. So kind of in a nutshell, I know it's a lot, but any questions?
So if someone calls 311 and they get transferred then to the 24-hour crisis hotline, if that's the appropriate, because how would people find out about the crisis hotline?
From what I know, and Sybil's the manager for the crisis line, she might be able to say a little bit more about it, but from what I understood is that we would give a prompt when they call 311. So if probably a script that says if you need to health assistance, and you can dial 3 or whatnot. Sybil, I don't know if you want to jump in and talk a little bit more of the 311. If she's on.
Hi. Yes. So Cindy was correct. Hello?
You're breaking off, Sybil.
Hello, can you hear me better? So basically what happens is there is a prompt, so individuals who are calling 311 and who would like to connect to a crisis worker who is a live trained clinician that is answering their 24-hour crisis line, will answer the call and be able to provide resources to mental health, substance abuse, and various social service needs, as well as assess if the caller would need additional services and provide brief crisis counseling over the phone to individuals. If an individual is in need of a well-being check, we will, hopefully we are able to get their address and the information that we need so that we can follow up with the police to request a well-being check. In the areas that we do have police crisis workers for, our crisis workers do go out and do assessments for. We have a grant with the Township of Proviso with their 708 board to provide police social work for them during the day, and then after hours we go out for mental health assessments.
Okay, Alderman Fleming.
I have a couple questions. So I think Ike is on the phone and he can maybe talk to the cost, because I believe we pay something for the services that these ladies are describing. But my question then, so Cindy, you guys don't go on the street now, right? That's correct. Someone calls or somehow or another gets transferred to you all, do some type of triage or so forth over the telephone, correct?
Correct.
Okay. So my concern, and my goal in this conversation again is to get people the resources they need. And when people are having, we have homeless people, we have people who have mental health issues, we're having people who have a lot of different times in which they're calling the police, or let's be frank, the people are having police called on them, and they're not in the stage, or they don't know how to call you, right? They don't know how to get connected to you, 311 or anything else. So I guess, in spite of the good work that you're doing, for me, it's still the need that I'm trying to fill, right? Which is when someone is calling 911 or having 911 called on them, that on the street, they're getting a response that is appropriate for their need. So it's great that we have you and people who know that you're around, or their mental health or crisis is not so severe that they can actually get to the phone and they know they can call someone. You fit that bill, but you might, I think where there's still some room there. I can tell you, I unfortunately had to encounter a young man who was having a psychotic break and called the police, who were really great. And they kind of talked me through some resources. It was very clear from this young man that he was delusional. Calling the police would not have been helpful because of what he was talking about. And it would have not, despite how great the police are, he was not in a good space. The police were able to help me find some resources in the community. And I think we sent him over to Trilogy or Turning Point or one of those places. But that is what I'm looking for, right? And so right now, all we have provided for our citizens is 911. Our citizens are not going to know to call you. The people having the issue are not going to know to call you. So, while I think that this is great, maybe what you're talking about, I think was in Mount Prospect or Morton Grove, where you have a police social worker. But Ike, if you can kind of tell me if you remember the cost that we are paying for this service at St. Francis, and then also, if it's okay with the chair, if you can speak a little bit to our health department. And I know we, have the victim services and they do some work. I looked at health department org charts from years and years ago, and it looked like we used to have a plethora of services that we don't have now. And so I'd be really interested to kind of hear from you what our health department, how we utilize these folks in the health department, and then how we maybe can get the correct services using our health department if we bolster that.
Okay.
Can you hear me?
Yeah, there we go.
I'm having some technical. Okay. Can you hear me? I'm having some technical difficulties today.
Yeah, no, we can hear you.
Perfect. My name is Ike Obo, Director for the Health and Human Services Department. And to address some of your questions, Alderman Fleming, first, let's talk about, you talked about the fee. The fee to have AMITA help provide the services at the library and the 24-hour crisis line is in the tune of $143,000 a year for them to provide these needed services. AMITA has been providing these services for a number of years, I believe about 5 to 6 years, to the community. So that is how much the city is paying them. In regards to the org charts, if you go back years and years, I would say 13 years or 14 years or so, we had a number of services in the Health and Human Services Department, including our dental offices, of course, the clinics. But due to budget constraints, as we all know, those services have since been dissolved. We also absorbed a number of other responsibilities and services that are kind of come back to the health department. For example, our ombudsman is now in this department, which was formerly in the Parks and Rec department. And the youth and young adults program was once with the health department, and we're talking about years ago. So they're parts of the health department as it stands. So in regards to victim advocates, as we all know, victim advocates was a unit that was attached to the police department approximately 3 years ago. And due to the reorganization, approximately 3 years ago, they are now housed in the Health and Human Services Department, but they're still at the police office. And that's very intentional. The reason being because of the scope and the nature of their work, we felt that it made the most sense for them to continue to operate out of the police station. Our victim advocates, they provide an array of services to the community, ranging from medical advocacy when it comes to individuals who've been domestically abused or sexually assaulted. They provide crisis intervention counseling. They also have referrals and assisting people for orders of protection. And a range of, I would say, issues that they respond to are sexual assault, suicide, death notifications. These are services that we provide. And when our victim advocates respond to these calls, they're usually accompanied, of course, with the police, someone from the police department, because of safety reasons, as DC Jody Wright indicated. So they get the phone calls and they respond at all times of the day. After hours, there's some times in which they respond to after-hour calls in the middle of the night, just to provide advocacy and support to those affected by crime. As it stands right now, we have only 2 victim advocates that respond to these number of calls. They are on call to provide these services, and these services are also to support and augment what our police department is doing so that we can provide the needed services in the community. These individuals who respond to these calls are all professionals. They've taken a number of training courses in various disciplines in order for them to provide the appropriate and needed services to our community. So it is a program that we continue to take a look at and try to make some improvements to it. And to Sydney's point about the consent when it comes to HIPAA regulations and what have you, it was some of the things that we started to have conversations about prior to COVID-19. And it is something that we'll pick up soon now that we are kind of having a breather when it comes to COVID-19 in our community. Any questions?
Is that the information you wanted, Alderman Fleming, or do you have more questions?
Yeah, and just to be really clear, so we pay $143,000 for the library social worker and then a 24-hour social worker at AMITA.
crisis.
So it's three things. So it's the Evanston Library, the crisis line, and then it's a community support worker.
And tell me again, Cindy, what the community support worker does?
This is the one that goes out and does the follow-ups, where we were doing home visits and stuff like that. So where, you know, it's the person doing the triage part of it.
Does the follow-up from a person's visit to a META or a person's call to the 911? I mean, to the
person's call to either 911 or if we get just a direct referral from workers at the city. So through the general assistance office or whatnot.
Okay, thank you. And how long will you work with someone when you do that follow-up?
But we have no time limit. I've actually been working with somebody that came through 911 and crisis line for 5 years already. And he's my ongoing client at this point, and the grant supports that because he won't be able to afford otherwise. He only has Medicare and cannot pay the 20% of it. So we cover all that through the grant.
Okay, so to me, it sounds like that service, and if the library ever opens up, I guess the library service is still vital because it does provide that long-term therapy or counseling, but we still, in my opinion, are missing that kind of response.
You're missing the gap. The gap that's missing is those calls, right? Responding immediately to a 911 call. So that's where, like I mentioned before, we have a model where we do have police social workers that go out with the police officers or whatnot. Or even if, you know, the talks that we're having right now, the St. Francis is having with Chief Scott is how to expand the program. And if they do end up expanding the way that we're thinking, then it would be you know, the fire department, the nurse practitioner, and maybe a social services person that will be on the call.
And Cindy, when you do that in Morton Grove, I think you said, who covers that cost for those police social workers?
So it's the 708 board that covers the cost. And we cover 12 towns and we have 4 police crisis workers. So they fund the.
So I think I'm having a hard time hearing you. I don't know if everybody else is.
Is it right now?
Yeah, we can't hear. Maybe Cindy, if you can get the model for us and send it to Eleanor or Ike and they can share it with us, that would be helpful.
Yeah.
Thank you.
I'm feeling like I'm going to need a giant chart that shows all these different pieces and interrelationships, and so it's a lot. Are there any more questions from the committee? Oh, yes, Alderman Rainey.
I just wanted to mention that the reason St. Francis developed this program is at the request of our police department. They came to us and they said, the 911 people came to us and said, this has got to stop. We have these, as you say, frequent flyers. I mean, just constant calls from the same people over and over and over that did not require police response. And so we sat down with St. Francis and they developed these 2-3 services, and that's how this came about. So it was very innovative on the part of the police department. So whether there's a gap there on how folks can initiate their own calls is one thing, but it was the police department that recommended that we do this. Just so you know.
Yeah, no, thank you. Alderman Fitz.
Ike, are the death notifications, are they 24/7?
So the death notifications aren't 24/7. The death notifications, we usually do it during the day. And if the death notification has to be made in Evanston or not sure, we have a victim advocate that is accompanied by a police officer make that death notification. So we try to make those during the day.
Okay, so what if something happens at night? Who notifies the family at night?
So at night, it is something that we, of course, are working through. We will talk to the police department, the officers who's in charge. And if it's something that requires a phone call, it is something that we can actually do. But when it comes to the actual visitation, to make that death notification, that victim advocate is accompanied by a police officer. But whatever that we can't achieve by making a visitation, it will be made via phone call.
Okay.
Excuse me, Alderman Revelle.
Whoop, yes, go ahead, Joey.
I just wanted to add to what Ike said and give Alderman Fisk a little bit more information. At night, if there is a notification that needs to be made, we do partner with our chaplains at the police department as well,
Right.
who will go out and make those notifications along with the police officers.
Okay.
And also we have been utilizing our in-house social workers, Ariel and Kelly, who's ever on call. We'll page them out, and they have come in at night to make these notifications.
Okay.
Alderman Ruth Simmons, you had your hand up, I think.
I have just some general questions, not necessarily for the most recent presenters. On the assist other agencies and assist outside police agencies, I don't know what that number is, Chief, but are those pretty equitable relationships or reciprocal? I mean, are we getting the same amount of service that we are giving to the other agencies?
Yes, ma'am. Those could be calls, a person that live in, hypothetically, in Skokie, who's concerned about a loved one that lives here in Evanston, and they'll call and ask us if we can check on the loved one. So agencies across the board reciprocate with those type of services.
Okay, and then for like involuntary committal, landlord dispute, city ordinance violation, miscellaneous public service, and maybe let's take off the involuntary committal on this question. In these, have we, and maybe this is a question also for Director Okbo, have we ever had a sort of like city service violation enforcement team, something along those lines, where we aren't sending a armed police officer for some of these like city ordinance violations, other municipal or miscellaneous public services, or even the landlord-tenant disputes?
Well, the landlord-tenant disputes, a lot of times we have our people follow up with the party or the landlord the next day in an effort to try to resolve whatever issue may be going on between the two parties. We also use other services, such as when we deal with homeless people that are out late at night. If they don't want the services of the connections for the homeless, some of these folks come from Chicago and they're familiar with Pacific Garden, and they'll ask to be transported down there. So we'll send them in an Uber or a cab down to that location, and the cab company notifies us when they get to the scene. So we do those type of services.
And also to add to what you stated, Alderman Simmons. Can you hear me? Okay. Yeah. To add to what you I guess your question about tenant and landlord grievances, we do have a service where tenants can call an organization that we partnered with called NTO if there are any grievances or complaints or issues, where this organization could provide legal advice to the tenant and also to the landlord. It's called NTO.
Okay. And then on the, for example, like the nuisance complaint. So I imagine those might be loud music and things along those lines. Would that be something included in a 911 nuisance complaint?
Yeah, we would hope that those kind of calls would come through the non-emergency number. But a lot of times they come through 911, and those are loud music, barking dogs, and things of that nature.
So my point there is, and I get those kind of calls often just from the neighborhood that, have called 911 or maybe didn't. They're calling me to complain. And I think some of this is just in really being neighborly, and not that it's, the community's responsibility, but even strong Black clubs help manage some of the community standards and neighborhood standards. So I know instead of calling 911, I generally, when the residents call me, just walk over to the neighbor and ask, will you turn your music down? And which is much different than an armed, police officer showing up. And we get these kind of calls all the time. I imagine more so in different neighborhoods, especially, we have a large student population on the east side of the ward. So is there a model where a certain type of nuisance call could get a different response, like a model in another community or a different designated staff person, just on some of these nuisance, because it can escalate, people get really agitated, they see the police. Just looking for some feedback on a way, because that's a pretty high number. It's like 467 calls. So I don't know if this list I'm looking at speaks to the cause and also the responses. But are there any thoughts there on the need for like an armed police officer to show up at a call, something more along those lines?
Yes, Alderman. A lot of communities utilize community service officers. Those are officers that handle the nuisance kind of calls and the type of call that you just spoke of. And we've talked about that here, getting funding to have community service officers. We could really, in light of what's going on in American policing, we could taper their dress where they would not necessarily look like police officers, but provide a service that if you added it up in man hours would certainly be less expensive than a police officer.
Okay, and then one more thing on the well-being check. So I get calls often about that as well. Generally, the well-being check concerns have been senior residents, and folks didn't see them in a while. And I think in every case that I've had this, the senior has been home and just had not been out in a while, didn't answer their phone, and everything was okay. I would look to consider having some sort of community service person to respond to that as well, unless there is a police reason why you would want to have a armed police officer show up to a well-being check. I guess those calls could go wrong, but in my experiences, generally it's been residents that have just been kind of checking out a little bit and they've been okay. Do you have any feedback on that?
Yeah, I don't like to qualify, some of these critical services that may seem mundane or would require a less threatening approach. It's just a fact that in America, the police officers are armed today. But when you go to these type of calls with citizens, where check the well-being, we never know when the citizen is going to be in distress. And having a full police and sometimes fire and police in conjunction to mitigate that particular call. Sometimes we have to force entry into locations to ensure that the senior isn't in distress. There's a lot of indicators that will go up into that. Some I won't talk about, but mail being piled up, the neighbors giving a response that this person every day and they haven't seen them in 3 days. Then it becomes our duty to clear the house in good faith. Under the law, we're not being held liable for that infraction of going in somebody's house. But we do ensure that we don't leave anybody's house unsecured once we go in and make sure that that senior is okay or not at home. We've had cases where they've been on the floor and for a couple of days and couldn't get up off of the floor. So, those are really the type of responses that a police officer is needed for.
Okay, then just one last thing on the drug-related activity. I would imagine that these calls are generally maybe suspicion of sales. But in the event that you have, what happens? This is more of a question. What happens if it is someone that is using? Like, are you arrested for if someone complains that they saw someone using drugs? Is that person arrested for that, for using drugs?
No, if we can have develop enough probable cause to search a person or see paraphernalia or things of that nature, but normally we're not arresting a user. But we do take those calls serious because, that's a bad thing. Just yesterday, down in Chicago, yesterday morning, they had 5 people OD off heroin in one hit, one call for service. It was 5 people that had OD'd. So we have to take those kind of calls serious also in our response to make sure that the safety of the individual and public safety is a paramount in those situations.
And then I may have missed this in all the presentations, but what do we have for substance abuse? Do we have an agency? Did we get a presentation there, or do we have a agency or a partner in town that we're working with for that? Because we know some of our habitual folks that are being arrested have substance abuse problems, and we keep arresting them, and we know that they are doing retail theft, for example, to feed a drug habit. And, this is so complicated, Chief, because there's so many different folks that are responsible and could play a role. But what do we do in that case? Do we have referral if they aren't being incarcerated and getting the rehabilitative services that they need? They re-enter back home. They still have an addiction. They continue to do retail theft. What happens then?
Well, drug addiction is to alleviate that is an ongoing process. I've worked closely with the Evanston Youth and Young Adults. We have, in conjunction, meaning the police department, gotten several individuals enrolled in drug addiction programs. We've monitored them throughout their stay there. We've had one individual who I won't name, but he came out early. We caught up with him right away. The youth and young adults and several of the police officers were looking for this individual. We caught up with him, and he said, well, he wanted to go back. We took him back. He got out. He didn't have any identification. We worked that out here in the police department. So, it's really, I guess you could call it like grassroots within government that government entities have been working to solve these kind of problems also, even though we're not out necessarily hooping and hollering for credit for it. But I do know the youth and young adult workers have been diligent about people in Evanston, getting them into rehab and monitoring them, getting them hooked up with connections for the homeless, things of that nature.
Maybe now's a good time to ask Audrey Thompson to.
I don't understand the part about consent.
Maybe Audrey to tell us about what's going on with the youth and young adult program.
Sure. So really our youth and young adult division really likes to tackle issues from really a 4-pronged approach. And a part of that is, education and workforce development. We even met today to kind of discuss how we need to really have our community partners rally to have a more comprehensive workforce development program, not just from the outside, but from the city of Evanston. And I mean, the city in all caps, from how we do workforce development from the inside of the city outside. So one part is, I like to Nathan always says, Nathan Norman, who is our youth and young adult program supervisor, he always says, I'm really the person that you want to see before you see the Evanston Police Department. Unfortunately, that's not the case sometimes, and we not only have programs that prevent, but also intervene. And so when we're talking about education, workforce development, there was a recent article that came out in the Chicago Tribune that talked about street outreach in Chicago. And I even said in the city council meeting last week that, street outreach is really what makes the difference. So when it comes to, developing civic responsibility, when it comes to establishing workforce development, we start with the Mayor's Summer Youth Employment Program, but we have to expand from that to, older individuals. So that goes from our youth all the way up to our young adult, which is 18 to 26. So I will say that we are starting to even be more of just, outside of youth and young adult, but more like family services. So as Chief Cook discussed, many times the communication with the police department is, we have young people who, may have, the community may have some concerns. And if we can do more of a prevention and get them at a particular stage and try to get them into employment that will be meaningful and also provide them a living wage, then that really, that really is what can, kind of curtail some of the violence that we see in our community. In addition to that, we're talking about, recreational activities. So we need even more activities that engage young people in the community. And also a part of that is mentoring. And, when we're talking about the youth and young adult division, doing peace circles to, when it comes to mentoring and making sure that if young people have some conflict, that our outreach team can go out and work with those young people. All of our outreach workers are trained in, Kingian nonviolence. And so just being able to extend that and have several of those types of sessions throughout the year, not just once or twice a year, but that is something that really needs to be ongoing throughout the year. So, I will say if someone's asking, what's on our wish list, we would like to see a more comprehensive workforce development program. We'd like to have additional outreach activities, whether that's recreational, whether that's Kingian nonviolence trainings. We'd like to increase that. And in order to do that, we do need additional, resources. So, I will say that I still feel that outreach is what makes the difference, but we do have to have the resources to put into outreach.
Thank you. Alderman Fisk?
Alderman Fisk?
Hi, Audrey. I had to unmute me. So when we talk about youth and young adult services, what is the lowest age of youth that you actually engage with?
I mean, we have clients that are as young as 4 years old. We have clients that are as old as 80. So while we say we're a youth and young adult, we can't just affect change with, the youth and not have some services provided for each one of the family members. So,
okay. And can you tell me a little bit about what cooperation, how you work cooperatively with the schools, with District 65 and 202, and then also with Cradle to Career?
Yes. So we have an outpost at Evanston Township High School. And so we have outreach workers that are at the high school daily. And so, of course, that has not been the case because of COVID. And so what we've had to do, because we can't, of course, be in the school, is we've had to engage our young people, whether that's through Zoom, whether that's over the phone, And also, we have been able to go to Mason Park in order to engage face-to-face with our young people and just make sure we're practicing social distancing. 'Cause sometimes it's just not enough to have a conversation with them over the phone. We have to have some in-person contact with them. And so with Cradle to Career, we are active with advocates. They're advocates. We were just on their Facebook Live on Saturday. That's the second time in a little over a month that we've worked with them. And Kim Holmes Ross, who is a really good supporter of the Youth and Young Adult Division. We are really, really working with her to do more work with Cradle to Career because, what we've said is, a lot of times in Evanston, we do really, really well with the cradle, but we need to do more with the career. And so that's where workforce development comes into. And of course, workforce development is more long-term rather than just getting a training and moving on from there. So if we're going to really, really do, workforce development, that's just not getting a person a job. That's all kinds of other approaches that you need in order to have a true, effective workforce development program.
Well, I've been convinced by people who are much smarter than I am that this is the area that we really need to pay extraordinary attention to, because this actually prevents the cycle of interaction with the police department that is most problematic. And so I just out of the Moran Center, other organizations, I just think this is our focus. I mean, while we're trying to provide services to everybody, this is where I want to provide the most attention. I mean, I don't know whether anybody else on the committee disagrees with that, but I just see, if we're going to make anything better for the next generation coming up, this is what needs to work the best. And we need the schools, we need the city, we need all of our social service agencies, we need everybody to hold on to these kids and help them through, I think. Do you have any thoughts about that?
Yeah, so Alderman Fisk, I'm really glad you brought that up, because when you spoke earlier, you talked about several different ways to tackle the issues that we're talking about tonight, just not through, one entity. And so when we think of MEAC, when we think of ETHS, we're talking about career pathways. So all young people do not have a goal of college. They want a different type of career. And so that's why this year we expanded the Mayor Summer Youth Employment Program because ETHS provided us a list of young people who had not named college as their career path, as a part of their career path. And because of that, we provided 15 opportunities, opportunities to 15 youth for a 12-week apprenticeship program. And so we've been wanting to expand the Mayor Summer Youth Employment Program for some time now. And this year we were able to do that. And so we just need to do more of that. I think a part of it is also making sure that when we are able to connect with the young person, that we have a job, a meaningful job right then. And so we can provide a job to that young person, but that's not enough. So then our outreach team has to wrap services around that individual. So we talk about, Chief Cook talked about substance abuse. Sometimes when we're working with a young person, there are all types of other issues, whether that's substance abuse, whether that's housing. So we have to use every opportunity and all of our resources in the city, which is why all of our community partners are important. So we always talk about pipelines. So it's really great. But if all of us just get the young person from 1 to 3, that's not sufficient. So what if I'm able to get a young person from 1 to 3, who takes it from 4 to 7 and 8 on up? So I think when we're talking about pathways, and pipelines, I think it's important for us to do what we do well and recognize there are other organizations who do great work, and we need to make sure that we're using and capitalizing off of those organizations in order to really fulfill the pipeline.
Thank you. Any other questions from the committee? I think we've heard about everyone who was lined up to speak to us. Am I correct, or have I missed somebody?
Alderman Fleming, did you have a question?
Yeah, not really a question. I was going to say, I think, again, we have a lot of work to get done. And so, understanding what Audrey was talking about in terms of youth and young adult, I think when we're talking about the budget, we should make sure it's a fully funded program. Even in terms of how it was initially designed, I think we might be down an outreach worker, if I'm correct. But also that's a piece of it, but still, I don't think that Audrey is saying that we're going to design our 911 response to be an outreach worker per se, although they definitely can play a role either in, helping that youth after they've had contact, keeping them out of the contact with the police, obviously keeping them or getting them this career or, whatever they're interested in, so they don't even kind of cross paths in that way. I think for me, for this conversation, I would love to make sure we're considering how they also work with violence interruption and then repair after there has been violence, as we've just had 3 deaths in town. So I think that's an important part also. Again, not necessarily the defund EPD conversation, because, EPD is doing their best to solve the crimes, but they're not then necessarily taking on the how we can do some healing in the community when folks still live here and they have been in a conflict and someone has maybe passed away. So I would love for us in the budget conversation to keep those things in mind for outreach, but not then, in my opinion, put them in this other pot of response to 911 calls. You're muted, Peter.
Muted.
Sorry about that. I saw you gesture. Audrey, do you have any updates on your staff? Any announcements to share?
So we still have, our 4 outreach workers, and our senior outreach worker is Jeremy McCrae. And then we have Nathan, who is really over our workforce development, Mayor Summer Youth Employment Program. So we actually are not down any outreach workers. I will tell you that is it sufficient? It's still not sufficient. It's not any more than it's not any less than we've had before. But I will say we could always use more resources. I wouldn't tell you that we don't need more resources. Each one of our outreach workers have their niche, when it comes to, our statistical reports and getting the word out, our social media. You have Deanna, and then you have working with the young ladies, Deanna and Lakeisha, who also, Lakeisha is really, really good in housing. So and then you've got a Latinx outreach worker. So
and that's the one I don't want you to move without, that's the one I was referring to. He was part-time, and I'll let you explain.
So he was a temporary employee, but now he is a permanent full-time employee. And so he is there. We made that, he was on Facebook Live on Friday, and people really got to see him and understand his good work. He's actually supervising our community maintenance team this summer. And so, we have, like I said, 4 outreach workers plus Jeremy. And that is, they all have their niche, but I have identified some areas where we do need additional resources. And a part of that is, getting young people who may have had some involvement with law enforcement and individuals who we have helped in the past and making them sort of like outreach, because we find that peers really listen to peers. And so if you're able to, have them also talk to their young people, a part of affecting change is making sure that they are able to have these communications with their peers in an effort to say, hey, you know, that's just not something that you need to be involved in. They take it a little bit more from their peers than sometimes me, who's an old lady at this point. So, you know, just the peer-to-peer interaction is also good. So there are just some places that we have identified that we need some other resources. Alderman Fisk?
Well, Audrey, I would like to know, in terms of our discussion, I would like you to make up your wish list and your wish budget, and let the committee know.
Yes, ma'am. Thank you. I appreciate that. And I also appreciate, you know, the city council and our interim city manager for allowing the Mayor Summer Youth Employment Program to continue. We have had a lot of success, even with, you know, we had to pivot, of course, because of COVID-19. But I will tell you, I have had numerous of calls from parents and young people who have just said this has been a wonderful summer in spite of. And so I really appreciate you all for, you know, still putting the resources into MSYEP. Young people are still getting paid. We have over 100 jobs, physical jobs, and over 260 young people who are now registered. And so peer pressure, you know, they say, hey, we're getting paid for listening to financial literacy. And then they're coming on, and every day we get 2 to 3 more people who register because they can register till the end and continue to get paid. And so it's really been a good pivot. And so I really have to thank you all and, of course, our staff for being able to pivot on a dime and make this program really successful this summer.
Thank you.
Good to hear. So, committee, have we heard enough from our array of speakers this evening? Obviously, we'll be calling on a lot of them to come back and talk with us further, but so we've received a whole bunch of information about 911 calls, and I'm going to ask that we just kind of digest it for our next meeting. And I'd like us just to, since it is already getting close to 9:30, I'd like us to go to our second agenda item for the evening, which is issues involved in hanging items on public property. And I think our legal department was going to share a few thoughts with us. Yes, Kelly.
Good evening, council members. Thank you for having me this evening. I was asked to take a look at the unfortunate incident that occurred last week at the beach, the Lighthouse Beach, with the towel depicting the symbol of the Confederate flag that was hanging over what appeared to be a city snow fence, one of those fences that Public Works and Parks and Recreation put up in order to protect patrons and the beach. And as we all well know, it elicited a lot of emotion and reaction from our residents as well as our aldermen and our staff. And I was asked to look at what other municipalities have done in terms of prohibiting symbols that may depict prejudice, hate, racism, all of these things that Evanston is just not about. And in doing our research, we knew right away this will be a First Amendment issue, as it always is. So the U.S. Constitution protects free speech, typically regardless of the content of the speech. Now, there are cases that have upheld city ordinances and resolutions that limit conduct that can be dangerous in eliciting speech. So for instance, we all know the old case of you can't yell fire in a crowded movie theater. You have a right to speak, but you don't have a right to cause an event that will ultimately cause others individual harm. So there are prohibitions on free speech, but what the Supreme Court has mostly said is those prohibitions have to come with conduct where there's an imminent threat of harm. So in examining what other municipalities have done, other municipalities, for instance, have passed resolutions that may say we the city will not hang one of these symbols of prejudice or hate at our city facilities. But limiting symbols and speech across the board is typically not upheld unless it comes with some sort of conduct that's happening with an imminent threat. So the best example again is yelling fire in the crowded movie theater. We have the right to speak, we have the right to express ourselves as Americans, but we don't have the right to do so at the harm of others. And additionally, what the courts have said too is that whatever you do in terms of passing a law or resolution, it has to, if it's going to limit speech, it has to pass what's known as strict scrutiny, meaning is the law narrowly tailored to achieve the element that the municipality or the local government is trying to achieve without censoring the speech? So is it content neutral? So in this case, we were able to easily resolve the issue because no one should be hanging property on city property. So whether it be towels to dry on a fence or hanging up something on the city building, that's just not allowed generally. And that's not allowed for health and safety reasons. There's a permit process to go through when utilizing city property. And that's all, again, to help regulate the public health and safety. So that's a content neutral reason that we wouldn't allow that. But outright banning speech and symbols across the board is something that municipalities and governments have to be very careful about, because the Supreme Court, has upheld the right to free speech, absent those imminent threatening circumstances.
Thank you. Comments from the committee? Thoughts? Questions? Alderman Ruth Simmons?
So I was on the side of, looking to our law to figure out a way for us to ban that flag as a symbol of hate from all of our city facilities and any event. I understand the free speech argument, but can we not make a statement as a municipal government? Obviously, that flag is a complete contradiction to all of our values here that we've stated in the city of Evanston. So what can we do? I mean, I hear you saying what we can't do because of freedom of speech, but what can we do as a home rule municipal government with values that are inclusive and welcoming?
Sure. So in other municipalities, they have enacted resolutions or ordinances that will say, for instance, we, the city of whatever, will ban this particular symbol from being hung at our city facility. So for instance, we will not hang the Confederate flag at the city facilities because we believe that this is a symbol of racism and hate, and that is not what our community values are about. I would expect that, and I will just say that I would expect that whatever the council would choose to do, we would, of course, like to work with the council because we would expect that there would be, in any event, always a court challenge, a federal court challenge. So we would like to work with the council to make it, make a way that would be, that would pass the First Amendment strict scrutiny constitutional muster if something were to be done. So unfortunately, in looking at, cities across the United States and looking at the Supreme Court case law, that's about the limits that cities or local governments have been allowed to go without it being viewed as a trampling on free speech.
And so what would that be again? Just a resolution stating that we,
the city of Evanston, for instance, shall not hang the Confederate flag at any city facility.
And so that would include any of our guests, whether they have a paid permit for a park or a facility, or if they are in any one of our programs that is city sponsored. Would that include our guests being prohibited from hanging it as well?
Well, that's where it gets more difficult. So you, for instance, would not be able to ban a patron from wearing his or her Confederate flag T-shirt coming to the beach. So we'd have to look at the specific language of what the council would like to do and narrowly tailor that wording to achieve the goal. The cases were very specific in the sense of it was so specific. It said, we, the city of whatever, we will not erect the flag, the Confederate flag, meaning on their own flagpole. And that's about as far as it went. It didn't go to say, people can't hang things on the city building because, in my opinion, I think we have ordinances to that effect already. You can't, for instance, I'm going to use an example. If we have a police horse set up to block traffic because of construction or a parade or whatever the case may be, residents can't just remove that horse or hang clothing up or other items on that horse. It's city property. Residents can't just design a mural on a city wall without obtaining city approval, things of that nature. So we wouldn't already allow that, which is why with the instance with the beach episode, it was a content neutral request to remove the towel. And again, I don't know if that it was one of the city workers that made that request. I think it was actually a resident that asked the patrons to take it down before a city worker could get there. But we would not allow anyone to hang anything on a fence. And that should be uniform across the board because, just for practical purposes, it's city property. It could damage the fence. It's there for a reason. And we don't, it just shouldn't generally be allowed unless, again, there is a permit process for all of that. So I think to answer your question, it's not a simple answer. It's something that we would have to look at. And again, it would have to be very specific. And I think we'd have to pull the examples of other municipalities that have done this and look at their specific wording and see what challenges, if any, they've faced and if they were to overcome those challenges successfully.
Okay. So I think moving forward with obviously we wouldn't hang it and we are not in support of it. I think that language could go along with however you advance that we would not hang it on our property. And then if you could see if there's any example of further restrictions. I understand that, you have to look at it legally, but if you could look to the fullest extent of prohibiting that as hate speech. And I know that there has been discussion, I don't have any background, but I know others have brought up that if we do this, that, Black Lives Matters, as an example, could be in question as also being hate speech. Totally don't understand that argument, but it's come up a few times. So can you give us any background on that?
Sure. So this is what they call a slippery slope in the legal argument. So when you're banning, so different symbols mean different things, different people. And, generally speaking, that definition is left more objectively and in some cases subjectively, depending upon the group and what it means to the group. So there was a case that was mentioned, I think, by one of the residents perhaps, or maybe one of the aldermen asked me to look at it, Virginia versus Black, where the Supreme Court upheld in part a state law prohibiting the burning of crosses on property. It was upheld in part because the Supreme Court said that universally that has been a symbol of not only hate, but it's a symbol meant to intimidate. And they looked at the history of the Ku Klux Klan and how that horrible symbol was used. And it is often in conjunction with a threat of violence or actual violence to an individual. Where the court said Virginia went too far with the statute is said that the cross itself is prima facie case. The burning cross is prima facie case in and of itself of an imminent threat. And the court said, no, it's got to be the cross in conjunction with an actual threat to an individual or to a group of individuals. And so that's just one example. I think when we're looking at what different things mean to different people, this is where we get into a slippery slope argument. So if we're banning speech of one kind or allowing speech of one kind, for instance, on city property, we can open up the door to allow any type of speech and any type of message. So we really would have to look at, again, the specific objective of what the council seeks to do. Because if you make it too broad, we will open ourselves to federal lawsuits and First Amendment challenges and temporary restraining orders as a prohibition of free speech. So that flag, generally speaking, we all know what that flag means. I think that's, pretty clear, but to others, they may disagree. And in terms of their First Amendment right to disagree, they have a right to disagree. What no one has the right to do is use a symbol in conjunction with offering an immediate threat of harm to another individual or a group of individuals. And that's where the law is pretty clear.
Okay, I just want to pause and actually thank the resident, LaShondra Smith-Rayfield, that I think did a fine job of defending the residents of Evanston and our position on that flag. So.
Yeah, she did indeed.
Yeah.
Alderman Braithwaite?
I think we've had a good conversation. I appreciate Alderman Simmons bringing this forward. I guess my own personal philosophy, and this is for the benefit of the committee and in the public, and that is, I don't want us to get distracted right now. We have some really serious initiatives ahead of us in this pandemic, and I'm aligned with your thought, Alderman Simmons, but my simple perspective is this: the Confederate flag has no power over me or anyone who looks like me in the setting that we're in right now. And I think you, a moment ago, Alderman Simmons, did a wonderful job in praising the resident. I think this is one of the situations where our community has spoken, and I think it's pretty clear. This reasoning does not matter, and I want to be clear. However, we don't see anything like this displayed on any resident. My understanding is this was a person who was passing through our community, and any more than I would want someone to stand in a line and say Black lives don't matter, say the colors for the LGBTQ, and I'm going to miss a letter, may not matter. I don't want to go down that slope either, and there will be people who disagree with me, but I don't mind saying this. I want to know who they are, right? I personally want to know who they are if they exist in this community. And my reason why is because they could work in a restaurant, they can work in a library, they can work anywhere. So if somebody is so bold to display that, I personally want to know who they are. I think if nothing else, the only thing I can credit our president for is that he has revealed to many of us who are sitting on council, as well as people listening, like who our allies are and those that bear watching. And so I think in these times, I want us to stay focused on the reparative, the reparations work. We're making some really good progress with what we're doing with our police department. We've invested a ton of time and resources. And I think individual one-offs like this, I'm just thankful that we have residents that stood up the way that they do. And again, I want us to stay focused on the work that we have ahead. Thank you.
Oh, Alderman Revvy, is a point of personal privilege. May I ask Ms. Ganderski 2 questions relating to this? Oh, okay. Ms. Ganderski, if someone were to come to an Evanston beach wearing a T-shirt that had the N-word emblazoned on it, would we be able to, would that be okay? Or that, legally speaking, would that be in violation of any law here in Evanston?
Well, I don't think Evanston has on its books any law prohibiting speech, period. We don't have any ordinances that prohibit speech. But again, what the law says is speech that is designed to elicit a threat and to create imminent harm is not allowed. That can be curtailed. So for instance, if someone were to wear a shirt like that in order to provoke a riot at the beach where there would be mass violence and all kinds of harm, then the city could curtail that. The city could stop that. But it's only in those instances. And again, I keep going back because the case law it's really clear, and it goes back a long way, that you may have the right to say there's a fire, but you don't have the right to scream fire in a crowded theater where people will trample each other to get out, when that's just not the case. So you don't have the right to threaten others with your speech and create a situation of imminent harm.
So and my last question, so using that framework, is it possible for the council to achieve Alderman Ruth Simmons' goal to craft legislation that specifically pinpoints that says if your intent is to incite, violence or harm, and knowing specifically what, it's not like it's a Black Lives Matter. We know the history of the Confederate flag. It is undisputable. No one can say, it's my opinion what this flag stands for. We know what it stands for. We know what its purpose was. So given that, unless someone says at the time that, hey, I'm here to do this ironically to make a protest, if that is not their reason, could the council draft legislation to ban the use of a Confederate flag or the N-word or, those kinds of materials out in public?
I don't think we can look at each possible incident in terms of a hypothetical, in terms of enacting an ordinance. I think what you'd have to look at is where the council could say, we as a city are not welcoming this conduct on city property, and the reason for that. So in the Virginia versus Black case, Virginia almost got it right, where they said, well, burning a cross on property is it's an arrestable offense, but they went further to say because the cross in and of itself creates an imminent threat of harm. The Supreme Court said no, not quite. The cross is a symbol of hate, but just the burning of the cross itself is not enough. It would have to be in conjunction with the harm. So I don't know. I mean, we would have to look at it. I think this would take more legal analysis, if I'm honest, to see specifically what the council would like to do. And the idea is, I think it would require a brainstorm in looking at other municipalities. But I'm not necessarily sure we need to enact something, because I think the law already protects Evanston in a sense, where if someone is doing this to incite harm, then yes, the city can step in and stop the conduct.
And also, Kelly, we already can say to somebody, you can't place your towel or whatever on the snow fence, because that we could already
correct
take care of. Yeah.
Correct. And in building off what Alderman Braithwaite said too, it's, if you look at the way that the day unfolded, as horrible as it was, you had residents on the other side able to voice their speech and send an equally powerful positive message. And I think that's really important, because I think, what our Constitution is based on is these expression of ideas. And we saw that our community did not stand for that. And I think it's important to note that, that speech was powerful that day in an equal and opposite manner.
Good point. Yes, Alderman Simmons.
So I have to add a couple things that the majority of the community did stand for it. So it took a woman to come from the south side of town to come and address it. And she did have some support and some backup when she did that. But apparently, it's my understanding that he was there, the flag was there for some time, at least long enough for her to get there, collect her kids, and come from the south side of the city. And then also staff was there. So this might be an opportunity, if nothing else, to let our staff know, even if they're seasonal or part-time, that what our policy is for hanging things on fences, because that could have been addressed just from our beach staff, the lifeguard or whomever was there. So if you could just make sure that that's being done as well.
And that's been done already.
Thank you. Thank you very much.
So I still would be in support of moving forward with at least a statement from our city on not supporting it in our facilities or raising the flag, something on behalf of the city. If you could come back to us with some language that would be appropriate.
Absolutely.
What I'd like to do now is just get a committee consensus about our meetings going forward. Next Monday, we have our city council meeting, but after that, we have 3 more Mondays in August. And then we have a human services meeting in early September as well. So that would be 4 possible meetings to pursue the conversation that we began this evening and get us ready for the 2021 budget that I think comes out in late September. We can ask the city manager to put a placeholder in the budget for us if we're still working on the details. So I'm wondering what you all think about our next scheduled meetings going forward.
I have a question on Morel. So we meet on the 10th as a council. So were you proposing that we skip that week?
Well, I am, just because I think trying to add it on to everything else on the 10th would be a bit much.
So then are you proposing the 17th and the 24th?
We'd have the 17th, 17th, 24th, and 31st. There are three more Mondays. Yeah.
I'm fine with meeting every Monday after that.
Okay, skipping next week because of council, but then planning to meet the rest of every Monday after that. Okay.
Except September isn't that Labor Day?
Right, but I think our meeting is scheduled for that Wednesday.
Oh, right.
The 9th, so we do have a regular.
So we would have.
We'd have
So we would have 2 more meetings in August. Is that right? I don't know why I can't get mine.
We have 3 in August, actually.
Okay. I'm fine with that.
Okay.
Yes.
All right, so that will be our plan. And I welcome your thoughts about the various questions we should be asking ourselves, the information we should be gathering. My thought was at our next meeting, we could hear from a variety of nonprofits in the community that provide the kinds of alternative services that we would like to make sure are available to our residents, and to see how that might fit in with what the city's already doing. So that's about as far as I've gotten in my thinking. Alderman Fisk.
Yeah, I like your reference to a flow chart, or however you were describing that. And I think if we can start filling that in, I'd like, and it was very helpful actually for Chief Scott to, tell us how many more folks he would need in order to, do the work that we might be asking him to do in order to reach 24/7. But those are numbers that we need to kind of plug in. So as we're talking about defunding and actually bringing, financial resources over to whatever program we designed, we have a good idea of how much we're talking about.
Right.
So I don't know how we start this chart. But Audrey Thompson, was really helpful, because I think that's a slightly bigger chart, and will be more money. But again, it gives us a sense of what we're looking for, because my understanding is that in the police budget, and somebody can correct me if I'm wrong, but in the police budget, where we have the possible funds are in the personnel category. And so that's what we can ostensibly draw from. So I guess I'd like a little bit of, I'd like a little bit of structure to this. And Eleanor, I can't think of anybody who's better at structure than you and Cicely. So,
right. We need to find a chart. We need a chart expert, though, to draw this thing for us. Alderman Fleming.
Yeah.
No chart expert, but I will, I keep saying this, but I would love for us to really be focused on this conversation. Again, the things that Audrey was talking about with outreach, if we're talking about, if we're talking about the use of the word defund, whether we like that or reallocation or whatever it is, I think we're looking at our police and 911, and again, getting their citizens the appropriate response for their call.
Right.
And that is not, unless we reconfigure outreach, that's not the goal of outreach. So Alderman Fisk, I think you're right. That's something we can think about through this committee or through the whole council in the budget discussion. And maybe that's a budget memo that we look at. But even in bringing in the nonprofit list, I think Alderman Revvy, you sent one out earlier this week. I think we should really be super targeted on those agencies as either providing some of this service now or maybe potential to provide the service. So I don't know that we need to talk to extra nonprofits. And I don't know, I can't remember what you have on your list, but we have a very limited amount of time. And so tonight was good education, but everything that we heard about tonight doesn't necessarily fit in the bucket for me. And so I would love for us, maybe the chart Alderman Fisk was talking about, really kind of what is the gap that we're trying to fill here in our service delivery and who can fill it. Whether I would advocate for a health department to fill it because we have a health department and we staff those people, and I'm not really comfortable outsourcing a 911 response because that's something that is super important and our citizens should have a guaranteed response for that. So I wouldn't personally be comfortable saying, hey, let's have Hawaii, for instance, respond to these kind of calls or whatever else. But all that to say, so going further with these limited amount of meetings we have, it would be great to get really focused on what we're trying to accomplish because we've already now been almost 3 hours or whatever on this meeting. And we've gotten good information, but I don't know how much we've moved the needle.
Right.
Alderman Fisk.
Yeah, but we also need to be aware that a lot of these calls require equipment. And so we need to plug in the fire department or someone who has the equipment that is actually necessary to make well visits, for example, or something like that. And I do really want to focus on the youth and young adult part of this because I think that's critical to the messages of concern, to put it mildly, that have been expressed over the interaction between our youth and the police and the direction that means youth will be going, and how we pull them back from that. So I see the delivery of services and then the youth and young adult as sort of the two main avenues that we go down to look at defunding.
Okay. Any last comments? Or are we ready for a motion to adjourn?
I move adjournment.
Second.
Okay, then all in favor, please say aye.
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 Okay, well, thank you, everybody. And thank you so much to everyone who came to give us all this good information this evening. We really appreciated it, and we'll be probably calling on you some more. So good night, everyone.